Growing concerns across the nation and here in Connecticut about flu season. 15 people have already died in our state. Health officials giving us a status report on the spread of the bug this morning. News 8's Noel Gardner has more on that in a live report from Hartford. Noel.
Keith, this news just in with the Department of Public Health, the flu season intensifying with people 65 years and older. Joining me, Department of Public Health Commissioner Dr. Raul Pino. Thank you so much for joining us this afternoon. Let's talk about it. Breaking news with the flu season intensifying. You're saying 65 years and older.
Yes, we have seen an increase of the number of hospitalizations around the state. About 75% of the people are 65 years and older. We have more than 1,000 people who have been tested and positive for influenza. And we also have 15 deaths so far in Connecticut. We have seen a jump. So we think it's an opportunity to alert our population about how severe this season seems to be, but also that it's still time to get vaccinated. It's not too late.
And you said those deaths are with the elderly.
Yes, all the deaths this year so far has been with people 65 years and older.
And you also said you still want to get the shot, the flu shot, right?
Absolutely. It's still time. Even there has been some talk about the vaccine not being that effective this year, but it also, even when it's not that effective, it does prime the immune system for a better response in case that you get the disease.
Why are we seeing the elderly checking into hospitals with flu this year as opposed to last year?
So interesting that you asked that question. Each year the strains of the viruses are a little bit different. Last year, for example, it did affect babies and younger more than adults. It's inexplicable. It depends on what strain of the virus is being responsible for the larger number of infections, and it's this year for some particular reasons that we don't know yet. It is being more aggressive with people 65 years and older. Are concerned with people that have pre-existing conditions, cardiovascular disease, diabetes, immune system disease, all the disease that could make it more difficult for them to fight the infection.
All right, doctor, thank you so much for your time today. We are live in Hartford. I'll send it back to you, Keith, in the studio.